Welcome to Apollo Spectra Facebook live session. It is an interactive session that regularly happens from Apollo Spectra Hospital by our top specialists from our different medical and surgical departments. We hope you tune into the session and ask our doctor for any query you might have. We introduce our leading consultant, gastroenterologist and hepatologist, Dr. Aditya Shah, who has vast experience in gastroenterology, and he has done multiple therapeutic and diagnostic endoscopic procedures. He has 12 years overall experience and he treats disorders related to gastrointestinal system, liver, pancreas, and gallbladder. Can you please tell a bit about yourself, doctor?
Hi, good afternoon, everyone. I'm Dr. Aditya Shah, consultant medical gastroenterologist at Apollo Hospitals. I am a gastroenterologist and a hepatologist. I treat diseases related to the liver and the GI system. In the GI system, I treat diseases related to inflammatory bowel disease, pancreas, gallbladder, stomach, colon cancers, and all. I do diagnostic and therapeutic endoscopy procedures as well on a regular basis. The diagnostic procedures include upper GI gastroscopy and colonoscopy. And in therapeutics, I mainly do bandings, then uh, GI bleed related treatments, followed by ERCP, endoscopic diagnostic endoscopic ultrasound, cholangioscopies, and all other routine procedures.
So, what all the disease you treat and what are the procedures you do, doctor?
That's what I already have explained. That I usually do diagnostic and therapeutic endoscopic procedures, and plus would be doing them on a regular basis.
Is lifestyle very important? What type of lifestyle you will suggest?
So our topic today mainly is related to GERD. In GERD and fatty liver disease, we usually have lifestyle which plays a very important role. Patients usually don't have a good lifestyle nowadays because of they are sitting in front of the system the whole day. The lifestyle is very sedentary. The movements are very less. As a result of which they tend to have a lot of reflux issues. In such patients, we tend to, uh, as a result of which they don't have a very good quality of life. Following which, they start having symptoms where they start having reflux issues on a regular basis, epigastric pain, bloating, burping. So we always suggest lifestyle to be a very important role. Plus, their eating habits are not on time. They don't sleep well. So in these cases, we say that lifestyle is very important.
Is prolonged fasting is good? In the case, what all should one should avoid it?
Prolonged fasting is never good because what happens is the stomach produces gastric acid which needs to be neutralized. The neutralization of the gastric acid will happen only if we eat some food or something. So unless the acid is not neutralized, the symptoms of the patient won't subside, and they usually tend to cause GERD, reflux issues. They even in future tend to cause gastric ulcers as well. Hence, we always recommend hence we never recommend prolonged fasting. A person should usually eat at regular intervals. The food has to be at small, frequent intervals. Means every 4 hours, the person, individual should eat something on a regular basis.
So, what is your take on lactose intolerance?
Uh, lac- Lactose intolerance is a very common finding nowadays, which we have in patients. Patients who are lactose intolerant tend to have GERD as well. So we usually tell these patients to avoid milk and milk products on a regular basis, uh, because of which they tend to have the reflux issues. Hence, always better to avoid reflux.
Okay, doctor. So, what is this gluten sensitivity?
There are some patients who even tend to have allergy to wheat and wheat products. Whenever they have these wheat and wheat products, they tend to have a lot of bloating, reflux issues. So these are the gluten sensitivity is again a factor where we usually come to know through a blood test and an endoscopy. In such patients, we tend to tell them to have avoid gluten on a regular basis in their diet. Once they avoid the gluten, they actually have a very good lifestyle. The food habits, they start gaining weight, they start becoming hungry. The bloating and the symptoms usually decrease significantly. There are patients with gluten sensitivity who actually tend to have a lot of iron deficiency anemia as well. So the moment they are on without gluten, the lifestyle improves significantly for these patients.
Is blood in stools anything to be worried about? So, what are the alarming signs of that?
Blood in stools is an alarming sign. In fact, blood from any part of the body is an alarming sign. We should, whenever there is blood in the stools, you should see to it that you have taken care and you go to a nearby doctor so that you come to know what is the cause for the bleeding. There can be multiple reasons for the bleeding. If it's just a localized bleeding like hemorrhoids, piles, or something, we usually tend to have only local management. But otherwise, we tend to suggest them as colonoscopy, endoscopy, and tend to find out the cause for the bleeding, which is very important.
Is blood in stools always cancer?
It is not always cancer, but cancer is, as a doubt, will always be there. Hence, it is always necessary to have see to it that whenever you have blood in stools, it is not ignored as a problem.
So, what is fatty liver, which has become a huge concern nowadays, doctor?
Fatty liver now is a proper endemic which is going on. Patients have, the moment you do an ultrasound or do a routine blood test, you come to know that your liver functions are deranged. You have ultrasound which will show that the liver is enlarged in size, there is fatty liver. These are very common findings which we find today because of our sedentary lifestyles, weight gain, diabetic, patients are diabetic, they have deranged cholesterol levels. So in such patients, we tend to have this finding of a fatty liver. Fatty liver is even found not only in obese people, but nowadays even in lean individuals, fatty liver is found. So it is not alarming, but you have to start taking care of it because it can always progress from non-alcoholic fatty liver disease to non-alcoholic steatohepatitis, which can further progress to cirrhosis of liver. So it is always necessary to see to it that your fatty liver is taken care, so in order to prevent the progression. There have been patients who have in future will may develop hepatocellular cancer as well because of the fatty liver. Not scaring you all, but then yes, you have to start taking care of the fatty liver.
What is the treatment for the fatty liver, doctor?
See, treatment for fatty liver is to treat the cause for fatty liver. So if a person is obese, you have to reduce weight. If the person has cholesterol, you have to decrease your cholesterol levels. If the person has diabetes, you have to see to it your diabetes is under control. And plus now with the advent of new medicines and stuff, we have a lot of medicines in the market which we give so that they can at least get your liver function test under control. But otherwise, the lifestyle and that is under your control.
So, why are the people very scared of endoscopy procedure nowadays?
See, endoscopy is always scary because you have something which is going on through your mouth or into your colon. So, but it is just a diagnostic procedure which, when needed, and the doctor will always advise you only if it is needed. And it's a diagnostic modality. So, unless you do it, you can't come to know whether you have an ulcer or an infection or whatever it is, because only after diagnosing we can start the treatment per se.
Nowadays, that endoscopy is it always necessary, doctor?
See, it's again, as I told you, it's a diagnostic modality. So it's not that you can tell it is necessary or not necessary. It's just like a routine ultrasound where we think that it is needed, people do it off. So even in a case of endoscopy, it's more of a routine test itself.
How much time the routine test takes, doctor?
Endoscopy usually takes only 5 to 6 minutes, doesn't take a longer time than that. Uh, Colonoscopy takes a little longer duration, around 10 to 15 minutes, but endoscopy is hardly 5 minutes.
So, Mr. Anirban Dasgupta commented like the clues is hydrochloric acid fascinating to produce more gastric juice in the stomach.
Yeah, I'm sorry.
He has been commented like the clues is hydrochloric acid fascinating to produce more gastric juice in the stomach.
Yeah, because that's what the stomach will become have a acidic environment because of the HCl which is being produced, and then you have to neutralize it so that you don't have these reflux issues on a regular basis.
Yeah. Any other questions? Okay. Hmm? Okay. The questions அவ்வளோதான் இருக்கு டாக்டர். Okay. So, what are the advanced treatments nowadays in the preventing the diagnostic and treating in gastroenterology?
See, in gastro, see now for let's concentrate more on the GERD thing. In the GERD nowadays, first is you have to first confirm whether a person has having GERD or not. In cases, if you can confirm with an endoscopy that the patient is having reflux, you come to know that there is a patient will usually have a hiatus hernia, will have a lax lower esophageal sphincter. In such cases, we tend to give them medications. First we start with medicines. If medicines are not helpful, we have endoscopic treatment as well as surgical treatment. If endoscopically, we usually tend to go for gordex, we go for fundoplications. But if that is not help, if the patient doesn't help that, then we always go for a laparoscopic fundoplication for the patients. So there are a lot of treatments, but we have to take it from basis of the patient to patient. It has to treatment changes from patient to patient as well.
Is GERD related to fatty liver?
GERD is not related to fatty liver, but a patient who is having fatty liver may have the simultaneous problem of GERD as well. That is because of the obesity, which will usually not allow the patient to sleep well, the posture won't be good. As a result of it, there will always be some reflux issues which will keep happening with the patient. So, in such conditions, we always tell them to reduce weight. Only if you reduce weight, things will become better.
Will alkaline foods help in reducing GERD?
There is nothing like alkaline foods will reduce the GERD issues, but yes, it will not see. It will see to it that you don't have a lot of acidic issues when you eat alkaline food.
So, what to do when there is any hyperacidity on regular basis?
See, there are a lot of treatments for that. First is try to improve your lifestyle. See to it that you eat every 4 hours, small frequent meals, less spicy, less oily. Plus, you should see to it your sleep is good. Have almost around 6 to 7 hours of sleep daily. And in spite of that, if things are not coming under control, sorry, you have to even have some half an hour, 45 minutes of walking exercise per day. That has to be a dedicated walking exercise. It's not just the routine exercise where you just walk from one place to another and you consider that as an exercise. Because people will say, I've gone from home to the bus stand, but that is not considered in walking an exercise. Plus, you should have less spicy, less oily lifestyle, daily exercise. And if in spite of that things are not getting under control, we always go for proton pump inhibitors, that is a pantoprazole, esomeprazole, rabiprazole, for a treatment of GERD.
Can fatty liver cause gastric problems?
This is a myth which usually patients will keep thinking that liver will always, because of the fatty liver, they have indigestion issues and everything. Fatty liver usually doesn't cause indigestion issues. It is the lifestyle of the individual which causes the indigestion issues.
Can liver problems cause excessive burping?
No.
Okay. Can omeprazole damage your liver?
Omeprazole usually is a very safe medicine. They usually don't damage any liver or anything. It is just that you have to see to it that you take medicines in control. All the medicines are not always necessary to be taken a lot.
Can acid reflux cause cancer? Can you please explain briefly?
See, acid reflux won't cause cancer, but there are patients who have reflux issues, and when we do an endoscopy, we come to know that they have been having cancer. So it is not that the reflux has caused the cancer, but it is just the lifestyle and everything which would have caused the problem to the patient. And when we have advised them in endoscopy, they wouldn't have been not willing to do it. So that's why we always say that whenever you have some issues, see to it that you have diagnosed yourself well. You see to it that you get yourself investigated well and don't ignore small issues.
How do you get rid of acid reflux in your liver?
Acid reflux in liver, I don't think so. That's a different. They are two different organs. They don't correlate with each other at all.
Will walking after food reduce the symptoms of fatty liver?
Walking any time of the day will reduce your symptoms of fatty liver. So it's not necessary you. It is only after food or before food or anything. You need to have some exercise for people who are obese and have fatty liver, so that they can have reduction in weight, which is the most important criteria for improving the fatty liver.
How to manage prolonged bloating?
That's it.
So, Mr. Vineet VP has commented, how to manage prolonged bloating of stomach, doctor?
So for prolonged bloating, again, first you have to find out what is the cause of the bloating. Is it the lifestyle of the patient which is the cause of the bloating, or it is some infection or something which is the cause of the bloating? So if you come to know that the cause of the bloating is reflux, then you have to start finding the cause for the reflux, like lifestyle, whether there's a decreased sleep, stress also plays an important role nowadays. Most of the people have a sedentary lifestyle. They don't sleep well because of stress, work stress, personal life stress. So try to solve all these problems. If you are able to solve all these problems in spite of that reflux is persisting, then you need to get an endoscopy done. Be sure that there is no other anatomical problem which is going on inside, and then we can take it forward from there.
Kiran Sharma has commented, is there any side effects of Zantac if taking on daily basis?
Any medicine on the long run is not good. Zintac, that is ranitidine, is usually considered to be the safest medicines. But then there have been places where we found patients to have early chronic kidney diseases, early they have vitamin B12 deficiencies and everything because of the decreased absorption. So whenever you are having it, please meet a doctor and take the medicine, not self-medicate.
Still, Anirban Dasgupta has suggested there is main two roles in the pancreas organ to maintain the blood glucose regulation and making hormones for the digestive system. He has been commented like this.
It's a comment.
Okay. Does baking soda
Helping?
help in the fatty liver?
No, there is no role for baking soda in fatty liver.
And basically, diabetes root from pancreas systemic dispute, which is still mysteries, which has been commented by Anirban Dasgupta.
Thank you.
Can liver problems cause digestive issues?
That's what again I told you. Liver doesn't cause digestive issues on a regular basis. It is just the lifestyle of the individual which is the main problem, and that will only help in causing the problems to improve better.
Can GERD cause liver problems?
No.
Can fatty liver be reversed?
Yes, fatty liver is reversible, but that's what again you have to treat the cause of fatty liver, and only when you do that things will become better. The person has to reduce weight, have decreased appetite, reduce weight, walking, exercise, uh, then lifestyle changes, decrease in eating non-vegetarian food. Plus, nowadays we also recommend brown rice instead of the white rice for treatment of fatty liver.
Can PPI cause fatty liver?
No.
So, can you give any take home message, doctor?
My take home message would be, please don't ignore your problems. Whenever you have a problem, please see to it that you meet a doctor nearby and solve your problem, so that we can at least diagnose what is the problem which you actually face, because always prevention is better than cure. Thank you.
Thank you, doctor.